The IPRO ESRD network program recognizes the challenges that the COVID-19 pandemic has inflicted in patient coordination and care, especially of those dialysis patients residing in a nursing home or long-term care facility. All parties involved in the coordination of these patients play a key role in their health. In this video, we will cover key information and best practices for dialysis providers. The same way dialysis providers are cohorting patients in a specific shift or facilities or even an area like isolation rooms, nursing home facilities are also cohorting patients to help contain the spread of COVID-19. Nursing home and long-term care facilities are allocating residents roommates based on COVID status. In addition, they have assigned wings or hallways as well as shared areas such as the dining hall or common spaces. In some scenarios, long-term care and nursing home facilities may also be transferring a patient to another facility based on their COVID status. CMS has made available this checklist for dialysis facilities in COVID-19 hotspots that contains best practices and tips corresponding challenging areas. One of these areas is the communication and coordination with nursing home and long-term care facilities. CMS recommend that there is a designated person at each facility to exchange information and foster communication. Educate patients, long-term care or nursing home facilities in infection control practices and expectations for communications as it relates to shared patients, and also coordination of care to assure proper planning of care and operations. You can find this checklist at the hyperlink below. Many states have been reporting nursing home COVID-19 positive cases through their state Department of Health. Review your state Department of Health website to find this data available for your facilities. Dialysis providers' leadership might find this information useful in caring and planning for these shared patients. Another best practice to consider is the alternative of home dialysis for nursing home patients. CMS has an interest in offering home dialysis for beneficiaries that are residing in a nursing home or long-term care facility as another strategy that can help contain the spread of COVID-19. Some benefits of this alternative can include better quality of life, improve clinical outcomes, eliminate challenges of transportations or waiting in common areas like the lobby, eliminates disruption of care like providing meals or medications, reduces the risk of falls or exposure to other illnesses, and increase the flexibility on coordination of care with other providers. If your dialysis facility has a high number of patients that reside in the same nursing home, this must be a good opportunity to discuss with this center. It is important to note that patients' provider can remain the same if this is an option they would like to pursue. Tanya Gibbons, registered dietitian for American Renal Growth Tone Dialysis Center, will be sharing her facility best practices. Tanya has a bachelor in nutrition and food from Auburn University and completed her dietetic internship at the University Hospital in Augusta, Georgia. She also has a master's in sport and exercise science from Augusta University. She has vast experience in renal nutrition and has championed improving her facility communication with nursing homes and long-term care facilities during the COVID-19 pandemic.
Thank you. So we here at Grovetown Dialysis realized early on, as I'm sure many of you did, the importance of open communication with our long-term care facilities and our transport providers. While most of our long-term care patients are fairly communicative and can tell us how they're feeling overall, they still might not provide the most accurate information regarding their symptoms, temperature, if they've been exposed to COVID, or if they've even been tested for COVID. So in the beginning, we primarily communicated with our nursing homes through phone calls. The nursing homes would usually call us with any changes or alerts on the patient's condition leaving the nursing home. The patients would still be screened at the door, and then we would in turn call the nursing home upon the discharge of the patient to let them know if there had been any changes while they were on dialysis. Our hospitals typically call our social worker with discharge information anyway, so that hasn't really been an issue during our COVID times. And also, most of our transport providers are extremely knowledgeable and familiar with our patients, and they're very helpful in letting us know of any issues that the patients may have experienced during transportation. So the phone call method of communication was fairly effective, but sometimes difficult to maintain given the hectic nature of both dialysis and our long-term care facilities, and then you tack COVID on top of that. So fortunately, we were provided with an alternative communication tool to use if we felt it would be beneficial. We decided to implement the COVID-19 status communication form to hopefully improve our transfer of information to and from our long-term care facilities. We provide our long-term care facilities a blank copy of the form you see on your screen for each patient at the beginning of each month. This form remains in the patient's communication folder during the whole month with their travel to and from the clinic. The nursing home fills out the top of the form on the first dialysis day of the month, and hopefully you can see some of the boxes that show symptoms and their COVID status. As long as the patient is symptom-free and there are no changes during the month, they simply initial and date the bottom of the form when the patient leaves the nursing home for dialysis. If any symptoms occur or there's a change in the patient's COVID status during the month, then we would start over with a new form. What you can't see is on the back side, there's also a section for us at the dialysis center to complete that informs the nursing home of any changes in the patient's status while they are on dialysis. And so we follow the exact protocol, same protocol to get that to the nursing home. We feel that this form has allowed us to better evaluate the daily status of our non or less communicative patients or those with cognitive issues, and it's relieved some of the added time constraint of multiple phone calls. It has not replaced phone calls, however, as obviously they are sometimes needed for clarification, and it has also not replaced our lobby screening practices. We still obviously check our temperatures and we do ask questions for our patients who communicate. However, we do rely very heavily on the information provided by the nursing home in our COVID-19 status form.
Thank you, Tanya, for sharing your facility best practices. And thank you for watching. For any questions, please visit our website at esrd.ipro.org and select the About Us option to select your ESRD network contact.